Alright, so we've got Kane Dobson here. Transfer from high dependency ward to the trauma ward. Fracture to his right tibia and fracture rates. Complaining of pain, 6 out of 10, yeah. And doctor has prescribed analgesia, morphine suspension. So I'm just going to check my medication chart. So morphine hydrochloride trihydrate, and it's due now at 12. Alright, so I'm just going to introduce myself to Kane, do another pain assessment, and begin my medication administration.
Hi Kane, my name is Tia. I'm one of the student nurses here from Western Sydney University. I'm just here to administer some pain relief for you, as I hear that you've got some pain. Before I do so, I just need to do a patient check. So could I just grab your full name, please?
Sure. Kane Dobson.
Yeah. And your date of birth?
31st of 3rd, 1994.
Alright. And have you got any allergies, Kane?
Yeah, I'm allergic to penicillin.
Okay. And what happens when you have penicillin?
My face swells up.
Alright. Well, we'll make sure we don't give you any of that today. I'm just going to check the number on your band here. So it's 095 6742. Perfect. Now just one more thing. What would you score your pain at the moment? Let's say 0 is the least amount of pain and 10 is the most.
A 6 out of 10.
6 out of 10. And where's this pain located? Does it radiate? Like is it in more than one area? Or?
It hurts on my right leg and my ribs on the right side.
Alright. And is that a sharp pain or is it a dull pain?
It's a sharp pain.
Alright. And does anything bring on the pain? Like is it when you move or when you inhale?
When I breathe in, it hurts.
Okay. Well, give me a few minutes. I'll be back in about 5. I'm just going to prepare your medication for you. I see that you've got your buzzer here, so if you do need me, just give me a buzz. Excuse me, could you be my second check?
Sure.
Thank you. Oh, you can't see that? It was on. Alright, so I've got Kane here. He's presenting with pain 6 out of 10 and the doctor's just charting him some medication. If you could just help me with this, Denise, I've just got to validate the order. So I've done my first patient check. The 3 points of identification here correlate with the patient's wristband. I have today's date. I've got morphine hydrochloride trihydrate. The route is per oral. The dose is 15 milligrams. It's due 6 hourly. This is today's date. It has not yet been given, and the indications of analgesia. The patient has a pain score 6 out of 10. Treated by the doctor, signed by the doctor, and I've identified he's got an allergy to penicillin. He's got a red armband. I believe this is a valid medication order. Do you agree? Yes. Alright, so I've got the essay here. So we have a medication name of morphine hydrochloride trihydrate. It's an opioid analgesia. It's used for the relief of severe pain. Contraindications is opioid hypersensitivity, GIT disturbances, and can cause constipation. Special precautions to note is patients with respiratory depression, cyanosis, and negative precautions are abrupt withdrawal for patients with substance abuse history, bowel disorders, and constipation. So the first reactions I'll let my patient know about is GIT upset, constipation, respiratory and cervical irritation. So looking at my dosing for adults, it's recommended that for adults it should be given in doses of 5 milligrams orally every 4 hours with a range of 5 to 20 milligrams every 4 hours. So the doctor's ordered 15 milligrams every 6 hours, so that looks like it's safe for me to give. I just need to check my patient's SAGO chart, check his resp rate and his pulse rate, pulse oximetry, and to make sure it's safe to give to him. Okay, are you alright to do my second check? Sure. Alright, so I've got my ward registrar here for morphine hydrochloride trihydrate, 5 milligrams per mil. So, I'm just going to do my first drug check, and then I'm going to do my calculation. Medication chart. Okay, so I've got the correct patient, as his 3 points of identification correlate with his armband. Allergies have been identified. He's allergic to penicillin. He's got the red armband. I validated my medication order. So here I've got morphine hydrochloride trihydrate. It's 5 milligrams per mil. The expiry is 2023 and the route is per oral. Today's date has not yet been given. And now I'm just going to check if I've got the right drug here in the SX. So morphine hydrochloride trihydrate, 5 milligrams. The balance says that I've got 50 mils, and it's a 50 ml bottle. So I'm just going to do my working it out now. So the doctor has ordered 15 milligrams. So 15 milligrams, 5 milligrams times 1 mil is equal to 3. You agree? Yep. So I'm going to do my second drug check now. I've got the correct patient. 3 clicks of identification, matches his band. We've identified that he's got an allergy to penicillin, he's got a red arm. I validated my medication order. I've done my working out, which you've agreed to, 3 mil. The doctor has ordered morphine hydrochloride trihydrate, 5 milligrams per mil, and 15 milligrams. Juice is out. Today's date has not yet been signed, and identification is for pain relief. He's paying 6 out of 10, and the doctor has printed and signed. Okay, so I'm just going to prepare the medication now. I have a syringe here for oral administration. So according to our calculations, we need 3 mil. Alright. 3 mil? 3 mil? Now could you just do my third drug check with me before we enter our documentation? Okay. So, I've got the correct patient. His 3 points of identification correlate with his hand. We've identified that he's got an allergy to penicillin, he's got a red armband. I validated my medication order, and our working out states that we need 3 mil. We've got 3 mil here. The doctor has ordered morphine hydrochloride trihydrate. Morphine hydrochloride trihydrate. 6 hourly. Today's date has not yet been given. The indication is for pain relief. He's got a pain score of 6 out of 10, and the doctor has signed, and it expires 2023. So we'll just do our documentation now.
This afternoon, and you've got Monday. Yeah. So you get a chance.
Okay, so I've double checked my meds. I'm just going to double check my patient's SAGO chart to make sure his odds are fine and safe to give him his medication. So he's between the flags here. His rest rate is recorded as 18. His pulse oximetry is 99 on the room air, so all these odds are fine and safe to give. Do you mind coming to do my second patient check? Yeah, cut it there. Hi Kane, I'm back with your medication. I've just got another nurse here with me. It's an S8 medication, so we just need 2 nurses to administer it. So I'm just going to confirm your details one more time. So could you give me your full name, date of birth?
My full name is Kane Dobson.
And I'm going to check your MRS, so it's 0 Are you happy with that? And Kane, your date of birth?
The 31st of the 3rd, 1994.
And have you got any allergies, Kane?
Yep, I'm allergic to penicillin.
Okay, and you've got your red armband on, that's good. So Kane, here I've got 3 ml of morphine. It's a strong pain relief since you reported your pain at 6 out of 10. Some side effects that you may have, you might get a bit of a upset stomach, you might feel your heart rate slow down a little bit and your breathing. However, I took your obs not long ago and they seem fine and safe to give to you right now. I will, however, come back in about 15 minutes to make sure you're doing fine, and you'll have my buzzer in the meantime, so if you do need me, give me a buzz. You're sitting up, so I'm just going to give you that medication now. Okay. Alright, Kate. So yep, I'm just going to be back in about 10-15 minutes. I'm going to do your paperwork and give me a buzz if you need. Are you happy to come sign this with me? Sure. Thank you.